This is a video of the addiction network as viewed by the BrainSurfer program, which is inside of NeuroGuide. That's a product of Applied Neuroscience Incorporated. At the moment, we're looking at time differences between the nodes of the addiction network, as recognized in this list of brain networks. Each node here, there's a sphere, is a Brodmann area. If I click my right mouse button, I get Brodmann area 46. On the left, here's Brodmann area 44. This is Brodmann area 32. These are all parts of the addiction network and represent Brodmann areas or nodes of that network. I'm going to now look at coherence, which is the functional connectivity or between the nodes. And the nodes are red because I've set the threshold for this individual who does not have drug addiction problems and substance abuse problems, so that the threshold is very, very low. Normally, we would have the upper threshold at 3 and the lower threshold, let's say, at 2 standard deviations, and in which case you have a fairly well-behaved addiction network, because this is now a normal network. When it's red, that indicates deviation from normal, and the goal is to make the network white, or you have the option to make it green. So as you look at the network, you think different things, you use biofeedback or cognitive strategies, emotional strategies to self-regulate the brain, and particularly in this case, the addiction network, since the idea here is to reduce the instability in that network so there's less craving that a substance abuse individual may be experiencing in the course of their drug rehabilitation program. And this is used in drug rehabilitation programs to help treat substance abuse patients and move them towards a healthy state in which the self-organization of the brain is occurring in dysregulated nodes and networks. Now we can zoom in if we wish and get a closer up view of the nodes and the networks and just focus on one particular node or one particular connection. We can rotate it, of course. We can also make the brain transparent. So do 100% transparency. And just look at the network itself. Some people prefer to look just at the network and not the brain that it's a part of. We will now, for landmark purposes, to identify the location of the network, restore the brain. So this is the addiction network, in which we can change different metrics. We can change different frequencies. Right now we're looking at alpha. I can change it to the theta frequency band. I can now change the threshold to make it appear. This is the kind of view you see when a patient is substance abuse critical, in which they have strong craving and the addiction network is hyperactive. And then the idea is to quiet this network down to minimize and reduce the cravings. We can also look at other networks, such as the anxiety network. That's quite a different network. We can look at the attention network. These are mental health networks that give rise, if they're not functioning correctly, to reasons why people do self-medicate to begin with. For example, anxiety or executive function problems. Pain, this is the pain network. So we can treat a variety of different networks that correspond to symptoms, depending upon the severity of the symptoms, and to help improve the mental health of the patients through biofeedback using methods such as this. This, again, is the addiction network. And so I was able to demonstrate the